A local doctor says she and her husband, who is also a doctor, are prepared to lose their jobs for not getting vaccinated against COVID-19.
She says she's fighting for personal choice, but one of the hospitals where she works says it has a duty to protect patients and employees. WFMZ's Jamie Stover has more.
Dr. Chaminie Wheeler says she's not against vaccines. She's had the flu shot and others, but she did not get vaccinated against COVID-19. And even as a healthcare worker, doesn't think she should have to.
We have to give individuals the freedom to choose their life for themselves.
Dr. Wheeler is employed through a physicians group and works at St. Luke's Anderson campus, but doesn't work for St. Luke's. Her husband is an ER doctor for St. Luke's, and she says he also did not get the vaccine. St. Luke's, along with other area hospitals, is mandating it. They know what that means.
So yes, I'm willing to lose my job.
Dr. Jeffrey Jari is an infectious disease specialist and senior vice president for medical and academic affairs at St. Luke's.
We always feel that along with rights, there is a second R, and that's responsibility. Our first responsibility is to protect our patients from contracting a disease which certainly can be deadly or crippling.
Dr. Wheeler has issue with that, too.
I'm sorry to say, but they don't have proof that it is for the greater good. When there's vaccinated and unvaccinated are carriers. That's why we're wearing masks as a vaccinated or unvaccinated.
Even if not perfect, Dr. Jari says the vaccines drastically reduce risk.
These vaccines, in a certain proportion of individuals that can range in the lowest incidence in terms of 40% and up to 80%, will protect you from getting the disease, period. If you don't have the disease, if you're not infected with the disease, asymptomatic or otherwise, you can't spread it.
Dr. Wheeler also has issue with the mandate given the newness of the vaccines. Dr. Jari says history shows major vaccine side effects are typically identified within 1 to 2 months of being on the market. The COVID vaccines have been around much longer. He also says mRNA technology, which is used in the COVID vaccines, has been studied for 30 years. Jamie Stover, 69 News.